everyone, it's Andy. I just wanted to pop on today and talk to you guys a little bit about miscarriage. I know a lot of our customers and a lot of our followers have had to deal with this really challenging topic. For those of you who follow Hilaria Baldwin, she just posted last night and today a lot about her recent miscarriage that she's been experiencing right now. So we thought it was a good opportunity to check in with you guys, give you some information about miscarriage, and just open up the conversation so that people have some more information surrounding it, because oftentimes it's not something that we talk a lot about. For many women, there's very limited things that you can do other than creating a good, healthy environment for yourself. Miscarriage affects everybody. It doesn't discriminate against anyone. And it can affect almost every single woman during their childbearing years. Don't feel as though it's something you did or didn't do that is causing a miscarriage. That's so important to recognize. We'll start off with some data, the facts and figures and the numbers that surround miscarriage. For every pregnancy that occurs, only 30% of the time are we gonna end up with a normal, healthy living baby. So if you think about that, that means that 70% of the time when egg and sperm are meeting, we're ending in most likely a miscarriage, if not something else later on during pregnancy. Miscarriages are typically defined as a pregnancy loss that occurs prior to your 20-week period or halfway through your pregnancy. The majority of these are going to occur in the first 12 weeks, which is often why many people prefer to wait to announce any pregnancies, because at that point, your chances of miscarriage are going to dramatically decrease. Even if you've carried a normal pregnancy before, everybody is still going to have a 15% chance of miscarriage. Once you experience 2 consecutive losses, your chances of miscarriage are gonna start to increase. So you start to hit about a 24% chance with 3 consecutive losses, about 30% chance, 40% chance definitely once you've experienced 4. So as you can see, if there's a pattern to your losses, especially if they're back to back, there's certain things that we're gonna start to look at in the medical community. The other important thing to consider, the rate of miscarriage is going to increase with increased maternal age. And this most likely has to do with abnormalities with your eggs. So the genetic material that is coming from the woman can become flawed or incomplete as we age. There is also a little bit of evidence that once the paternal age hits about 40 and older, the sperm age may have some factors as well. Miscarriage can happen once or it can happen back to back, like we've been talking about. When it happens consecutively, we start to refer to that as recurrent pregnancy loss. It's important because usually this is going to be happening prior to 20 weeks of pregnancy, and it also may indicate that there's certain other things that we want to look at. With a single miscarriage, most likely we're looking at a genetic problem with the fetus. So that means that when your sperm and your egg meet, there's a genetic problem with the way either the sperm or the egg's genetic material was initially, or the combination of that material was incorrect. When we start to see the pattern of 2 or more or recurrent pregnancy loss, there's other factors that we want to consider. 5% of women are going to experience 2 consecutive losses during the time they're trying to conceive. And this can be either when you first start trying or after a normal pregnancy. Even if you do have a normal pregnancy, there's still a chance for recurrent pregnancy loss in your future when trying for a subsequent pregnancy. Only 1% of women are going to experience 3 consecutive losses or more. So when we're looking at why does this happen, there's a number of factors. Very often we won't know. About 50% of very early pregnancy loss is going to happen prior to your menstrual cycle. These are usually pregnancies that people aren't even aware of. However, once we get a little bit later on and once we have identified that you are pregnant, we are able to get a little bit more information from people who miscarry about what could have gone wrong during that process. One of the most common things that can be happening is abnormal genetic material from the mother or father. This isn't necessarily an issue all the time, and so that's why you and your partner are normally healthy and fine and don't have any issues, but your genetic material doesn't match up well together. They can do genetic testing and identify if there's any of these abnormalities and help with genetic counseling to explain to you what kind of treatment options are available to help prevent the chances that you'll have an unusual mix-up with your DNA. Another common issue is a problem with the genetic material of the baby. So this is when the sperm and egg meet and either it doesn't completely form together or there's an issue with the replication of the DNA of that egg and sperm. So the most common things we think about with fetal chromosome abnormalities are trisomies, when there's 3 copies of a gene instead of 2, or monosomies, meaning only 1 copy of a gene, and oftentimes issues with the sex chromosomes. There's definitely genetic abnormalities that do end in viable pregnancies. Down syndrome is a very common example of this. So not every chromosomal abnormality in the fetus is going to lead to a miscarriage. However, the majority of times your body is able to recognize it, so your body will instead miscarry. There's also issues for women who have congenital abnormalities that are anatomical with their uterus. This could mean that you have an unusually shaped uterus. Normally our uterus is shaped about like this. Some women might have where the top kind of comes in a little bit and it can form kind of 2 separate areas in the uterus. If you do experience miscarriages, oftentimes part of the workup is going to be an ultrasound to determine what your anatomy looks like, because there's no way for us to typically know without an ultrasound or imaging to understand if your uterus has a normal shape to it or something that's slightly abnormal. The other uterine condition that can happen is called Asherman syndrome. It's fairly uncommon and pretty rare, but you can create scar tissue in your uterus, which basically creates an environment where there's no appropriate place for the embryo to implant properly. There's lots of endocrine factors that can come into play, which is a huge reason why a good supplement routine can be really important. But some of the endocrine factors, a luteal phase deficiency. This is when there's an inappropriate amount of hormone during your luteal phase or the second half of your cycle that doesn't help promote those very early stages of pregnancy. Once you get into a fertility setting, they'll be able to test your hormone levels to identify if they think that might be some kind of issue. PCOS, as we know, can cause fertility problems. Thyroid conditions can cause issues that can lead to miscarriage, whether or not your thyroid is overactive or underactive. Obesity is also another really big factor that can lead to miscarriage. So maintaining a healthy weight is really important when you're trying to conceive. Another thing that we know is associated with miscarriage is thrombophilias or inherited blood disorders. Your blood supply is so crucial to being able to support a pregnancy, so frequently they will do blood testing to see if you have any of the more common blood disorders, even though in general they're not very common. If those are identified, there's ways that they can help support you through a fertility journey to help give you a better shot at being able to maintain and manage a pregnancy. And of course, we know that environmental factors play a huge role in fertility. So there's certain environmental factors that are directly linked with your increased risk of miscarriage. Number 1 is going to be NSAIDs, non-steroidal anti-inflammatories. These are medications like Advil, Aleve, naproxen, Motrin. So that's why during pregnancy, it's only recommended to take Tylenol for pain relief. You want to make sure that you're getting adequate levels of folate prior to conception and early in pregnancy to ensure that you're giving your body the best shot to help maintain a healthy pregnancy. We know that smoking and drinking alcohol both have negative side effects and can lead to miscarriage as well. Caffeine, especially in the first trimester, can increase your chance of miscarriage. So this is anything more than 200 milligrams a day. Whatever coffee you're drinking or tea or soda, all of that stuff has caffeine in it. So you just want to have a good pulse on how much you're getting every day. And if you're thinking about conception, it would be a good time to start to cut back on some of that. Dry cleaning chemicals, lead and mercury as well. So if you live in an older home, it's really important to make sure that you don't have lead paint around. And Accutane, which is a medication that's used to treat acne for people, definitely linked with increased risks of miscarriage. People find out about a miscarriage in a number of different ways. If people are aware that they're pregnant, Often they'll find out because they start bleeding early in pregnancy or having pain or discomfort, and later on during pregnancy with a decrease or an absent fetal heartbeat, either in your appointments at your office visits or on an ultrasound. If it is during a doctor's appointment, they will want you to have another one to confirm, and they will discuss a whole lot of information with you, which is the only time that they have to talk to you about it, but isn't necessarily the best time to be hearing it because you're in a little bit of a state of shock. So we're gonna go through information that they'll talk to you about during that time in case you need to reference it at any point in your journey. Early in pregnancy, there's a few ways to manage a miscarriage if it's been identified. You can do expectant management, which is probably the least common option, but all this means is that you wait for your body to pass the products on its own, and essentially you have a heavier period than normal. For some women, they like this option because they can do it in the comfort of their own home, surrounded by people that love and support them. They like the thought that their body is handling things naturally. So it's a great option for some women, especially if you're early on in pregnancy, like 8 to 10 weeks or less. Also, you can add on during this time certain oral medications that can help make this more natural process a little bit easier. They will make you a little bit crampy, but allow your body to more easily pass everything that's been in your uterus and give you a little bit of peace of mind that things are all out and removed. There's also certain medications that may be used to terminate a pregnancy. And again, this is all very early first trimester pregnancy losses. Once you hit that 10 to 12 week mark, usually what becomes recommended is an outpatient surgery. There's pros and cons to having this procedure done. It's very common. Many women have it. Usually you'll be in an office setting or an outpatient surgical setting. You're sedated. They'll remove everything from your uterus. The main reason being that if certain products are left behind, that can be a reason that your body would not get pregnant subsequently, and also can cause things like uterine infections. So it's really a health concern for you at that point. During the procedure, you won't really be aware, but you can be groggy. So there's other things to consider if this is an option for you. Anesthesia sometimes is nice for people, other times can be more difficult to tolerate and manage. Likely you can have somebody there for after your procedure to be there to support you and be with you until you're able to go home. But it can be a little bit emotional and overwhelming, especially if you have to go by yourself. They can often schedule these procedures in the next day. The other benefit that it can often provide is they have access to the fetus that was created to identify if there was a genetic problem with the fetus. A whole nother part of management is how you deal mentally and emotionally with a miscarriage, and this can look so different for so many people. It's so important to make sure that you have a support network that's important to you to get you through this challenging loss. So whether that's your partner, some family and friends, or if it's professionals, therapists, or medical provider that you have a good relationship with. And there's so many incredible support groups out there for women who have miscarriages and deal with miscarriages on a regular basis. What's most important is that you take care of yourself physically and emotionally during this time. We want you to know that here at Binto, if for any reason you need a happy ear to talk to or somebody to just lean on a little bit, we're here to help, to just talk you through stuff or just listen to you if you need to vent, so we can get you plugged in with different resources to fit your needs. If you have any questions about any topics miscarriage related or anything else that you want us to help clarify, just let us know. We're here on chat. You can always DM us or send us any emails, and we'd be happy to help.